Hello, and welcome to One World, One Health, with the latest ideas to improve the health of our planet and its people. I'm Maggie Fox. All of us here on planet Earth are facing problems such as pollution, climate change, and infectious diseases, old and new. All of these problems are connected. This podcast is brought to you by the One Health Trust, with bite-sized insights into ways to help. When people think about infectious diseases, we usually think about viruses and bacteria, maybe parasites like the ones that cause malaria. But there's another cause of infectious diseases, fungi. We're not talking about mushrooms or truffles. Fungal diseases such as Aspergillus, mucormycosis, or black fungus disease, and a new pathogen called Candida auris directly kill 1.3 million people a year and contribute to the deaths of 5 million more people, according to the World Health Organization. In this episode, we're chatting with someone who's trying to do something about it. Alastruey-Izquierdo works at the Mycology Reference Laboratory at Instituto de Salud Carlos III in Madrid, Spain. She's also a member of Global Action for Fungal Infections, or GAFI for short. She's trying to make people aware of how we're making an already bad problem worse with some of the ways we spray crops and with climate change. Anna, thank you so much for joining us.
Thank you, Maggie. Thanks. Very happy to be here.
Can we run through some of the fungi that infect people and how they get them?
Yeah, that's a very important question. There are over 1.5 million species of fungi, but only a few of them can cause disease. They play a crucial role in breaking down organic material. They are important for food production. They produce the cheese and beer. So everybody knows fungi. We could not live without fungi. Who could live without beer, bread, and cheese? Nobody, right? But the ones that are really pathogenic are the ones that I like, because that's where I do most of my research. There are only a few hundreds, but they cause disease both in humans, in animals, and in plants. The ones that are in humans, the most frequent are Candida albicans and Aspergillus fumigatus are the most frequent ones. But there are some others, as Candida auris, that has been arising in the last years that are really causing important problems in the outbreaks in hospitals that are very difficult to control. And also there are some mucorales that were important during the COVID. They caused a big problem in India. And the range of diseases that they can cause are also very, very variable. So they can cause superficial infection. So who don't ever have somebody around them that doesn't have an onychomycosis, so an infection in the nails. It's very frequent. That is usually caused by fungi. And they are also caused, but vulvovaginal candidiasis is also very frequent in women. But they cause severe diseases with high mortality rates.
And one of the most new and severe diseases is Candida auris, which is spreading especially quickly of late in Europe. It's even closing hospitals in countries such as Brazil. Can you talk a little bit more about Candida auris?
I think it has been like the star in the fungal world in the last years. It was just recently described in 2009, and we only knew it because it was isolated from an ear infection. But then suddenly in 2015 or 16, several outbreaks started to raise in different countries. So it was suddenly a nosocomial pathogen, a pathogen that was causing infections in the hospitals. And it's now becoming a big problem, as you said. So there are outbreaks in hospitals in Italy, in Greece, in Spain, a lot in the US, as well as in Brazil. But it has been worldwide, also in South Africa. So it's a very interesting pathogen, especially because it's very resistant to the treatment.
And you mentioned it started out as an ear infection. How can an ear infection make people so sick that they might die?
That's something that we are still not very sure about how it happened. But there is a theory that could be because of the global warming and all these environmental changes. Because, as I said, there are 1.5 million of fungal species, but only a few of them can cause disease. So the hypothesis is that this species was around in the environment without really being a real pathogen. And then it caused an ear infection, which kind of is still superficial. So why the fungi, this species cannot cause disease? Because they are not able to grow at 37 degrees, our normal body temperature. So they think that with the global warming, it's making the fungi adapt to grow in higher temperatures. And that's how this pathogen, this jump and become a fungal and human pathogen. But this is only theories. It has never been proved. But what did happen is that it spread all over the world. It popped up in different parts of the world at the same time.
Who's vulnerable to these fungal infections? Do they infect normally healthy people, or is it people who have some kind of immune suppression?
Yeah, that's an also very interesting question. So fungi are ubiquitous. They are all around. Everybody breathes spores every day, and usually the inhalation of spores is the main route of infection. However, most of us do not get sick. And there are a group of fungi called endemic mycosis that are also able to cause disease in immunocompetent population, in normal people with regular immune system, but they are restricted usually to certain geographical regions, are related more with specific environmental exposure, like the valley fever, coccidioides, which is in the US. But usually most of the fungi are opportunistic infections. And who is at risk of them are the immunocompromised people. So people with HIV, hematological patients that are taking immune suppressors for transplant patients. For example, your immune system needs to be reduced to be able to receive this new organ, and all people with chemotherapies, biological treatments. So whenever your immune system is not in a perfect shape, then there is a place when the fungi come up and they can cause a disease.
And of course, you can treat these fungi with drugs, but some of them are developing what's known as resistance to the antifungal drugs. Some are also already naturally resistant, right, to antifungal drugs that we use. How does that happen?
You see, everything is interesting in the fungal world. So one of the biggest problems compared with bacteria is that we have a very limited number of treatments for antifungals. So when we say this is a multi-resistant or a pan-resistant fungi, it's like we have mainly 3 classes. So it's not that we really need to invest more in having more treatments. But going back to your question on how this happened, there are fungi that are intrinsically resistant. So there are some species that they are resistant to all the treatments that we have now. And these are, for example, Lomentospora prolificus, which is a rare disease. But whenever you get it, it's very, very difficult to treat and mortality is very high. But there are some others, and this is where we are more worried now, that are developing resistance. And this is rising. The numbers are rising worldwide now. And why are these developing resistant? Because of the pressure. It can be on one side from the clinical treatment. So these are sometimes patients that had very low treatments because either they have a chronic infection or they are prophylactically treated because of their weak immune system, and this is very prolonged because they are in long term. So they can develop resistance because of these long treatments in the clinic, but they also develop resistance because of the use of fungicides in the agriculture, in the plant, because fungi are mainly pathogenic to plants.
So let's talk a bit more about that. How do crop and plant treatments affect these fungi, and can you talk about how they help them develop resistance to drugs that are used in people?
As I said, fungi are one of the major groups of pathogens that can affect plants. So these antifungals are used to protect the crops and the flowers. So it's really neat. We really need to treat them to be able to protect them and not get infected. So the problem comes when these antifungals that are used in clinic are also used in the fungicides in agriculture. And then it has been demonstrated that despite not being the same specific agent, the chemical class is more or less the same. So it has been demonstrated that using the same class in the environment, treating the plants, they put a pressure into these species and they develop resistance. So as we were saying, the fungi are all over the world. So they are really they are ubiquitous. So they are in the plants, in the seed, everywhere. So whenever you treat the field with fungicides, you are putting pressure over them and they develop secondary resistance that is also resistant to the treatments that we use in clinics.
Why do we even do that? Why do we use these same chemical treatments on plants and crops as we use to treat people? How did that even happen?
This is a very good question. Seems stupid, right? It's like, why would you ever do that? While there are differences between plant and pathogenic fungi and human, they share the fundamental characteristics, so the antifungals are effective for both groups. And it's very difficult to develop new antifungals because they are fungi in contrast with bacteria and viruses. They are more close to us, so they are eukaryotic. They have an eukaryotic cell, and it's more difficult to develop, to find targets that you can fight that are not toxic to us. So there is a very limited number. And taking that into account, and the same, despite not being the same species always, but species being related that use the same antifungal works through them. That's why they have been used in fungicide.
It sounds to me like the people who develop these antifungal crop treatments weren't talking to scientists and physicians who treat fungal diseases in people.
Yeah, I think we are making a difference now. So it's true that in one hand, you cannot ask the agricultural people to not use fungicides because they are really problem there and they also need something to treat the plants. But what we are now trying to open the discussion and group with them, it's like at least trying to protect the new entities, because we've seen this with azoles, which has been a group of antifungals that has been for more than 20 years in using both in the clinic but also in the environment. But now there are new classes, luckily in the last years, there have been a development of new antifungals. And there are 2 new classes of antifungals that have been in clinical trials, and they are costing millions of dollars and also years of research that are still not licensed to be used in the human environment. But in the fungicides, in the agriculture, the regulations are not that big. So to develop a fungicide is very short time. So they have been already licensed fungicides with the same mechanisms of actions that can be used already in the environment. So the aim of this group of people that has been trying to put together all these stakeholders is trying to protect the new agents. And I think now, as you said, it seems stupid, but we are in different worlds and sometimes you really need to talk to each other and it's sometimes not that easy.
The World Health Organization recently released a list of the priority fungal pathogens. Can you talk about how that's useful?
I'm very happy that the last October, the WHO released the first ever fungal priority pathogen list, in which we have prioritized the most important species, taking into account this antifungal resistant problem, but also mortality, severity, sequela, complications, incidents. And we have detected several areas for action, meaning public health, surveillance, research and development. And I think it's important to convey the message, and I like this, that can be to amplify the message that we need to develop new antifungals because they are very limited, but we also need to create better diagnostics because we still don't have a very good diagnostic for a fungal infection. Sometimes, or in many occasions, fungal infections are diagnosed late or even in the autopsies when in post-mortem. And this happens also, usually a fungal infection is suspected after a couple of rounds on antibiotics that are not responding, so they don't know what to do, and then suddenly somebody comes up and says, maybe this is a fungal infection. So we really need to improve the capacity also and to improve the knowledge and make more awareness and educate healthcare workers in all levels. I think this is very important to really, because these infections, they don't have specific signs and symptoms. So they are always suspected less. So this list from WHO has had already an impact, and many people is now paying attention to fungal infection. This is creating awareness is one of our main priorities, and initiatives like this podcast, it's very fundamental to us.
Anna, thank you so much for joining us.
Thank you.
If you like this podcast, which is brought to you by the One Health Trust, please share it by email or on social media, and let us know what else you'd like to hear about at owh@onehealthtrust.org. Thanks for listening.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Lakshminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.